Hello, friends. Today we will ask all the questions you wonder about IVF together with gynecology and IVF specialist Dr. Deniz Özgen. Doctor, could you first introduce yourself to us?
I am Doctor Deniz Özgen. I am in charge of the IVF unit at Okan University Faculty of Medicine Hospital. We have had an IVF unit here for 6 years, 6 or 7 years, and we have been successfully helping couples who do not have children and couples who want to have children.
Doctor, what exactly is in vitro fertilization? If we need to give general information, how can we explain IVF?
In vitro fertilization is actually an artificial laboratory environment in which all the procedures that should be done naturally are done outside in an artificial way. It is very important to say that in the IVF method, the cells of that couple are used completely. In other words, the egg and sperm of that woman and that man are used. The sperm or egg of someone else is not used in Turkey. This is forbidden in Turkey. I want to say that first, in cases where the egg and sperm should normally combine inside the human body, but this process is not possible due to any negativity. We do this outside in the laboratory environment, and increase the chance of pregnancy by placing the fertilized egg and the embryo ready to attach into the pledge.
In fact, this is also the answer to our question on how to do IVF. Doctor, for whom is IVF treatment recommended?
We first recommend IVF treatment above a certain age. Let me put it this way. If a woman is under the age of 35, has been in a relationship for a year, has a regular relationship, and there is no pregnancy, or if there is no pregnancy despite a regular relationship for 6 months over the age of 35, IVF treatment is appropriate. Of course, we do not do IVF treatment immediately. First, we try to find the underlying causes. We investigate whether we can have a child with other methods. If we think that we cannot be successful with other methods, or if we think that our chances of success are low, then we turn to in vitro fertilization.
Well, thank you very much, Doctor. Doctor, what are the factors that affect success in IVF treatment?
There are many factors. The most important factor for us is age. The age of the woman is the most important for us. I would like to say this first as the most influential factor. Delay is very important for us. It should not be delayed. Pregnancy should occur at an early age. The fertilization capacity of early eggs and the possibility of creating a healthy baby increase. Apart from that, there are many other methods. IVF treatment is perhaps the fastest developing treatment method compared to other treatments. And I cannot say that we as a country or Turkey have caught up with this. On the contrary, we are leading the way in this regard. So I can say that the most successful centers in the world are in Turkey.
Thank you. In couples, does the woman's age affect the man's age? Does the age of the man also affect it?
In men, of course, the factor is also somewhat effective, but not as much as in women. Men can produce healthy sperm even at older ages, because sperms can always be reproduced. But eggs are not like that. Eggs are born with a certain number when women are born, even when they are still in the womb. Our time period is gradually decreasing, but since there is a constant reproduction in men, if there is no problem in this production process, the age factor in men does not affect us as much as women.
Thank you, Doctor. Doctor, how many days does IVF treatment take?
IVF treatment starts when the woman is menstruating. If there is no problem in the examination on the 2nd or 3rd day of menstruation, we start the treatment, and until the transfer of the environment. In other words, we developed the eggs, collected the eggs, fertilization occurred, and now we transfer them. The period from the first day of treatment until the transfer is a period of about 15 to 20 days.
Thank you, Doctor. What is the average age limit for IVF treatment?
IVF treatment can be performed as long as the woman is menstruating. We do not have an age limit. In other words, a 35-year-old woman can also go through menopause, and a 55-year-old woman can also go through menopause. Therefore, even if she is 50 years old, if she is still menstruating, IVF treatment can be performed. But as I just mentioned, the number of egg quality will decrease due to age, and the chance of IVF treatment will decrease. On the other hand, if we look at the social side, we prefer to leave this choice to our patients, as it is more difficult to maintain pregnancy at an advanced age, and it will be difficult to take care of and raise children at an advanced age.
Thank you, Doctor. Which tests are important in the initial evaluation of couples who consult a doctor?
In couples, we ask for a sperm analysis to look at the sperm count and quality in the man. In women, we have some hormone tests to see how the ovaries are working. Apart from that, There are also tests to evaluate ovarian reserve. Apart from these laboratory tests, we also use imaging methods. There are some imaging methods to see if the tubes are open or not, or to see if the inside of the uterus is suitable for carrying a pregnancy.
Doctor, are there any side methods you use to increase success? I mean, supportive methods?
There are many different methods, and as I said, IVF treatment is a constantly evolving treatment. There are methods that we used before, but then we thought that they did not affect the success too much, and we stopped using them. And there are also proven methods that have been found in the past and are accepted to affect the success in the follow-up and continuation. In our center or in other centers, I don't know. But there are many of these methods that we use in our center. We use many methods such as endurobonding, hysteroscopy, or calcium activation. These methods are selected individually. IVF treatment is also a personalized treatment. Not everyone is given the same treatment. Not everyone is given the same treatment, and the method used in the first treatment of any patient may not be used in the second treatment. IVF treatment is completely personalized, and these additional methods are used specifically for that person. As I said, sometimes we try a new method. Sometimes we try methods that have been proven in the past.
Thank you very much. Doctor, in IVF treatment, do we do embryo on the 3rd or 5th day?
In fact, we have seen that there is not much difference between day 3 and day 5 enduro transfer. However, since our current technology allows enduras to go up to day 5 in the laboratory environment, we prefer day 5 enduras, because we think that an enduron that has made it to the 5th day will have a better chance of being more fertile. When the number is small, if we have only one enduron, sometimes we transfer on the 3rd day, without waiting for the 5th day. There may be a difference in terms of the chance of success only in that respect. As I said, recently we now prefer the 5th day endo, because our laboratories now have the capacity to follow the enduras until the 5th day.
Thank you. Doctor, is egg retrieval a heavy procedure in IVF treatment?
Actually, if you don't use anesthetics, of course there is a lot of pain. An enduro ender is performed under general anesthesia. Therefore, the patient does not feel any pain. We let them rest for a few hours after the procedure. After we see that there is no problem, after we are sure that our patient is not in pain, we send him home to rest. Yes, it may be painful, but we do not cause pain.
I understand. Thank you very much, Doctor. Doctor, my personal curiosity is actually the most miraculous IVF treatment that has ever happened to you.
I talk about this all the time, and I like to talk about it a lot. When I was training for this job 10 years ago, the first enduro transfer I did was the woman's 19th attempt. There was no pregnancy until then. I am also a beginner. What would this woman think when I said that she would not get pregnant? Or that transfer I did was the woman's 19th attempt, and she became pregnant?
It's a miracle.
That's why they shouldn't give up. We are always with them as much as we can.
Mr. Doctor, thank you very much for your valuable time.
Thank you.
Thank you, Doctor.